I'm Dr. Padidar at MISS. We're here with Vansera. She is one of our angio-CT MRI guru techs. And she's also one of our patients.
I had a uterine fibroid embolization here at the Miss office.
And how was your experience?
My experience was awesome. It started out, I was having like impromptu breakthrough bleeding, which as females, we know that can be quite embarrassing. So I talked to Dr. Padidar, who I've worked with for many years at several different locations. And he explained to me the procedure of the uterine fibroid embolization and how I would benefit from having that procedure done and how my bleeding can be vastly decreased if that was done. So I came into the Miss office and Dr. Padidar agreed to do the procedure on me. Okay, so Dr. Padidar performed a procedure on me. I was a little nervous having a procedure done, but I've worked in radiology and all aspects of radiology for the past 35 years, so I was very familiar. I just hadn't had it done on myself. As a patient, I didn't want to have to be laying still and not being able to move, so when I came in, I knew that I wanted to have the radial approach done from Dr. Padidar.
Okay.
That's when they go in with a catheter. For my particular surgery, he did a radial approach. So they went in through my radial and put the catheter down towards the fibroids, and he attempted to embolize the fibroids to decrease my bleeding.
So you had you did a fibroid embolization because you had fibroids. And what were your symptoms?
Tons of bleeding, breakthrough bleeding, massive bleeding.
And what have you done for it before?
Well, one of the doctors before, he put me on birth control pills, and then other doctors, they just give you different medications, but nothing seemed to work.
Okay. And why didn't you go see your gynecologist?
My gynecologist wanted me to get a hysterectomy, and I didn't want to do that.
Yeah. And so had you had any other one in your family have a hysterectomy?
Only my mom.
Your mom had it?
Yes.
Okay. And how was your experience with the fibroid embolization?
Fibroid embolization experience was awesome. Since I had the radial approach, I didn't have to lay flat for 2 hours afterwards because it was in my wrist area. So the recovery for me was very well. And basically, I was back to work the next day.